Hey guys, welcome back to No More Cavities. Today we are discussing the lateral aspect of the skull. So first thing is that we will discuss the bones. This bone present here is the frontal bone. This bone present here is the parietal bone. This bone is the temporal bone. And this bone here is the sphenoid bone. The bone here is the occipital bone. This is the mandible. There are different sutures in the lateral aspect of the skull. The suture that join the frontal bone and the parietal bone is known as the coronal suture. The both parietal bone are joined with the help of the sagittal sutures. The parietal bone and the temporal bone here are joined by spheno-squamidal suture. The parietal bone and the sphenoid bone here are joined by the sphenoparietal suture. Here the sphenoid bone is joined with the frontal bone, which is known as sphenofrontal suture. And the parietal bone where joined the occipital bone is known as the lambdoid suture. Then here this thing is known as the zygomatic arch. Here a suture is present which join the temporal bone and the zygomatic bone, known as the temporozygomatic suture. Another suture which is present here which join the parietal and the mastoid bone is known as parietomastoid suture. This area here is known as pterion. Pterion is the combination of the sphenoid bone, the frontal bone, the parietal bone and the temporal bone. The different suture ossify at the different ages, such as the coronal suture ossify at the age of 30 to 40 years. The lambdoid suture ossify at the age of 40 to 50 years. The sagittal suture ossify at the age of 20 to 30 years. This suture present here is known as the frontozygomatic suture. The bone from here to here is the zygomatic bone. From the frontozygomatic suture to the zygomaticotemporal suture, this bone is the zygomatic bone, and the bone from here to this thing is known as the maxillary bone, maxilla, and the bone here is, obviously we know that this is the mandible. Other thing that we can see in the lateral aspect of the skull is the external auditory meatus, and this thing is the auditory meatus, and this cone-like structure which is present here is known as the styloid process. This was all about the lateral aspect of the skull. Thanks for watching.